Hello, my name is Anna Maria Keneally, massage therapist here at Neal's Yard in London Bridge. I've been a therapist for over 6.5 years, working both back home in Ireland and here in the UK. And I've been in London Bridge treatment space for the past 2.5 years. I've worked in a number of different treatment spaces over the years, from spas to gyms to my own home treatment space. And I offer a number of different therapeutic treatments, which are all available online for you to view. But today I'm going to speak to you about myofascial release treatment. I'm also currently studying to gain my diploma in advanced clinical massage, and I look forward to completing that in early next year. So what is fascia? Fascia is tissue that surrounds and connects all the structures in the body. It is primarily made up of collagen, and it lies under the skin. It serves to attach, stabilize, enclose, and surround all the muscles and internal organs. Interestingly, all fascia is connective tissue, but not all connective tissue is fascia. Myofascial release techniques work to release deep tension in the muscle tissue. It can sometimes be the key to resolving long-held tension and chronic pain in the body. In my treatments, I offer direct and indirect myofascial forms. Both of these forms are slow and gentle and often incorporate quite a lot of still work to get deep down into the connective tissue layer, with a lot of contact between therapist's hand and client's body. This can be experienced as being something really quite profound for the client, and the experience can feel quite deep and connected. Both indirect and direct forms of myofascial release require a listening touch from the therapist. The difference between these two is that with indirect work, the therapist really tunes into where and how the tissue wants to move and release itself. And with the direct work, there is a gentle encouragement of the release of the tissue by more moving, using techniques such as skin rolling and stretching of the connective tissue more directly by the therapist. MFR can be extremely helpful for treating those who are recovering from injury, from helping with chronic systemic conditions such as chronic fatigue syndrome and rheumatoid arthritis, as well as people who have suffered from trauma. In general, it can be an extremely relaxing treatment, helping to calm the nervous system, work on the deep connective tissue layers of the body, helping to release deep tension through the entire system. On the first meeting with the client, we'll go through a consultation form in order to assess the current health, well-being, and lifestyle of the client. During this first assessment as well, we'll go through a postural analysis as well as mobility assessment in order to work out where pain and tension is held in the body. We'll also discuss whether this is a once-off treatment or if the client is hoping to work on some kind of pain condition. If so, I will recommend a course of 6 sessions in order to see a decrease in pain. I begin each treatment with a grounding, connecting touch in order to establish that first point of contact with the client and relax the nervous system. Then move into different techniques. As you can see here, this cross-handed stretch where I allow the hands to melt into the connective tissue and put the fascia on a bit of a stretch. You can see here some more direct work using very soft fists to once again melt into the connective tissue and gently encourage this kind of movement in that connective tissue layer just beneath the skin. The work is very slow and intentional. And it's less about going deep and more about maintaining that connection between therapist's hands and the connective tissue. You can see here is skin rolling technique, so more precise work on the neck, really finding a lift in the tissue and then gently rolling it, working through any adhesions or restrictions there into that neck area. And again, very slow, intentional work. Once again here, working with that skin rolling technique, this time down the length of the back. You can see the thumbs remain quite still as move the connective tissue forward and down. When any sort of restriction is encountered, you can put the tissue on a little bit of a pull, stretching at different angles in order to find that release. You can see here the client has very healthy connective tissue. This is again more direct work, using thumb on thumb pressure to gently stretch into lower back. And you might actually stretch the arms a little bit or wherever you're working on. Depending on the client and what their needs are. And we'll always finish again with some more kind of grounding work,